reliable internet access and computer to be able to participate in an online course. If for some reason you don't have reliable internet access and a reliable computer, then probably online learning will not be the best scenario for you guys this term. If you're going to be doing, so when you go to do your exam, if your internet's kind of wishy-washy a little bit, I would suggest setting up a time that you can be on campus in a room by yourself to take your exam, so that way you have reliable internet, okay? So if that's something that your internet kind of goes in and out, that might be the best choice for you guys, okay? I obviously will be your instructor. I will give you guys feedback as we go throughout the course. It won't always just be boring PowerPoints, me lecturing at you. We'll do Kahoots. I also have a program that's called Menti that kind of uses the PowerPoints, but then there's questions and interaction within that. Your online course will also include homework, okay? So your discussion posts, things like that, quizzes, your exams, NCLEX questions, and some HESI practice exams, okay? The announcements will post each Friday for you for the following week with your information kind of for the upcoming week. If for some reason you can't get into something there, then just let me know, okay? You are responsible for knowing what you need to do each week. The syllabus breaks that down as well as the announcements. If you have any questions, reach out, okay? So if there's an issue, your first contact is myself, like I said, email or Canvas messaging, or if you really need to text me or something, you can do that. But I get your emails and your Canvas messagings just as fast as I would get your text, okay? I'll provide feedback through your grades. Biggest thing is if there's something going on in your life, let me know. If there's a death or, anything like that, just let me know if it's going to affect your coursework, okay? If you're having computer access issue, you sure can start with me, but I'm not the most helpful person. So a lot of times I'll direct you then to IT, okay? You can also check with your campus instructors or your campus deans if they'll be the most helpful regarding your campus courses, but like if you're doing lab or clinical or simulation, that would be who you should talk to if there's an issue going on there, okay? If you have any concerns about class, your online class, start with me. And then if I'm not able to get you those answers, I'll reach out to Professor Styles, who is the LPN PEDS head course lead. And if she does not know the answer, then we'll reach out to Dr. Brown, okay, who's the dean of the online nursing program. Communication-wise, okay, sorry. Good old snow and cold, then no school days and no daycare days. Okay. Let's try again. But the biggest thing is going to be just staying in communication with me, okay? So like I said, if there's something going on in your guys' life that's going to affect your coursework, let me know. Now you guys can just see yourselves probably. Be professional when you guys are doing your post, okay? Keep in mind, and in class as well, be considerate of others' feelings and experiences. If someone's sharing their experience, be respectful. use proper grammar and language and titles, okay? And then don't type your discussion posts in capital letters, okay? You have specific start and end times, so that will happen each week. Class is Monday, starts at 9 a.m. Eastern time and is over technically at 11:45, but because of our break times, we'll be done at 11:25-ish, okay? The only day that you guys do not have to be here this term is the 20th of January, because that's Martin Luther King Day. And then when you guys have your HESI exams, we will not do class that week either, because your HESI will be like your class attendance, okay? These are mandatory classes, so if you are not here, then you're not getting credit for being here. You do run the risk of, if you're missing too much online course time, to automatically be dropped without question, okay? Like I said, your discussion board post, your initial post is required by midnight Pacific Standard Time on Wednesday. And then your 2 peer replies are midnight on Sunday each week Pacific Standard Time, okay? And that's all mapped out, like I said, in the syllabus and also in the announcements. No cheating, no plagiarism, no forging or altering assignments, okay? Can't be giving others answers, okay? So if any of this is found out, obviously you guys are potentially at risk for being dropped from the program, okay? Don't be putting materials from your exams out there online either. We have people looking at all of those exam kind of material websites often, okay? Our code of ethics. So this is the nurses code of ethics, making sure you guys are following the code of ethics. You'll have to follow this into your professional roles as nurses as well, okay? Do not use sites that promote cheating. Like I said, we have professors and instructors who are on these sites looking at them. So if you're found to be on one of them or putting material on them, then, you know, we'll have to have a meeting. And if it continues, then it's a course failure, okay? Late work policy, you should submit your work on time, but late work can be accepted if there's prior approval from myself, which means before the due date, you guys need to let me know that it's going to be late, okay? And kind of a reason. You don't have to totally disclose everything to me, but if it's something major, then let me know what's going on. You have up to a week late to submit things for a 10% deduction. If it's 8 days or more, it's a 0. Kind of nothing that I can do about it at that time, okay? Attendance, like I said, that will be taken during our live sessions. You guys need to make sure that you're signed in with your full names that Fortis knows you as, okay? You have to be on camera the whole time, can't be pointing at the ceiling. If you're at work or you're driving, I'll have to kick you out of the session. Also, if you're riding in a car, we've had to get really specific. So no being in a vehicle at all, okay? If you are 1 minute late, it's 15 minutes missed, okay? If it's 15 minutes missed, then it's 30 minutes missed. That's kind of, it just rounds up that way, okay? If for some reason 2 weeks in a row you do not come to class, then you'll be dropped, okay? And there's really nothing that I can do about that, or Professor or Dr. Brown can do about that. That's just kind of an automatic thing that happens in Campus View, okay? And there's no makeup for missed attendance. So if you have an appointment or something like that, or your kiddo has an appointment and you can't be here, you're just not here, okay? And it just counts against your attendance. So I kind of already went over this. If you are missing more than 20% of your course time of our attendance, then you will drop a letter grade. Okay. So don't miss more than 20%. Okay. If you're at 5%, you will get an email through Campus View. Okay. If you're at 10%, you'll meet with myself and Dr. Brown. Okay. If you're 15%, you'll be required to meet with your campus administration. And like I said, 20%, you're going to be dropped, and also then you'll have the whole letter grade dropped. Okay. Key to success. Step 1, make sure you're doing all your reading assignments. If you do not read for this course, you will not pass. Okay. It's just as simple as that. The PowerPoints and all of that sort of stuff, it helps augment kind of what you've read. But if you're not reading the material, you guys are going to struggle. Okay, so that's the first thing I suggest, is reading your coursework assignments each week. Also, check into what's due each week, and then show up to class. Okay. Make sure you're reading all the directions on the rubrics. Okay, so like using source, a reliable source for your discussion post, things like that. Okay. We'll do CJ Sims. You guys do not have any papers during this course. Okay. NCLEX questions, discussion boards. Okay. And then obviously studying and completing your exams and your quizzes. Okay. You need to be logging in 4 to 5 times a week to make sure you're staying on top of things, making sure you're looking at your course assignments at least once a week. If those are updated, I will send, you'll get like another email kind of that there's an announcement. Okay. Submit all the assignments when they're due, and then making sure you're checking in for the following week, towards the end of the week. Okay. And like I said, each Friday, those will be posted. And don't procrastinate. Keep in contact with me, have reliable internet and laptop or computer. Okay. Maintain the schedule for completing your schoolwork. If you're working a ton of hours, it's going to be really hard to be successful and stay on top of your schoolwork. Okay. And then making sure you're completing your work. So day 1, today, you guys should have logged into campus. You logged in, you joined me for our live session, but you should also be, printing your syllabus or saving your syllabus and all of that. Okay. And like I said, if there's for some reason you can't get into something, then definitely let me know, and make sure that you have the right textbook and the right edition. Okay. Come to class prepared. Make sure you're interactive. You have questions, ask them. Don't be afraid. I'm not really a scary person. So just ask. If you need a tutoring session, I will try to figure out a time that works for you. And like I said, if you're having technical difficulties, you can sure try to reach out to me, but otherwise technical support is probably the best choice. Weekly review sessions. So Professor Stiles, I believe, plans to do HESI weekly review sessions again. She will post within our course calendar when those will be. Last term they were Tuesdays. I'm not sure if she's going to do them on Tuesdays again, but those are highly encouraged. They're not required or mandatory by any means, but attendance is taken to kind of keep track of who was going to those, in case at the end of the term we have a situation maybe where we're struggling kind of riding the line with a grade or something. Those who attend the exam review questions or sessions, tend to do better on the exams. So each week, the week prior to the exams, all of us instructors will have a review session. Mine will be Mondays after class, okay? So you guys can stay on for those if you want, or you can join another instructors. And then as they're done, we upload those recordings then in an announcement for each exam. The other thing is under each course announcement for each week, there's a study guide. Okay, so like this week, there's study guide 1. Utilizing those for your quizzes and your exams will be helpful as well. Okay, so your next your first quiz is next week. It will be over this week's material. Okay. Tutoring, if you need tutoring, let me know. Okay. KGA, so 80% of your grade is KGA, which are unit exams, quizzes, and your HESI. Okay. The other 20% of your grade is your homework, everything else. Weeks 1 through 5, your homework scores will be turned off. Week 6, I will turn them on, and then week 8, they will be shut off again. So until week 6, that's purely your KGA score. Okay. You have to have a 78% or higher before you get any credit for your homework. Okay. And then once I turn on the homework, you have to continue to have a 78%. Okay. You have to have 2 devices for each quiz or exam. So you have to have your laptop to run the exam and then your phone to be watching you on Zoom. Make sure it's charged or on a charger because you can't go off of camera once you're checked in for the exam. Okay. It's an automatic 0. Okay. Quizzes are a part of KGA. They're completed during class time. We'll do them at the beginning of the class. It will be on material from the week before. Okay. You have 10 questions and they're 15 minutes and you only get 1 chance to do your quiz. Okay. And you have to obviously stay on camera. Exams are given through ExamSoft. You'll log into Zoom on your second device, then you'll sign into your ExamSoft on your main device, like your laptop. Okay. You'll read all the exam discussion or descriptions carefully, and then I will check you in. Okay. Do a check of your surroundings. You'll need your ID and a whiteboard or a piece of paper if you want to use that. And then you'll need to upload that. Okay. Make sure both devices are charged. Quizzes cannot be made up for any reason. Okay. So if you miss a quiz, they can't be made up. Okay. Exams, you're only allowed 1 attempt. You cannot stop it. You can't pause it. If you're having technical difficulties, stop your exam and let me know right away. And we'll try and figure something out. The exams are timed, so make sure you're paying attention to that. If you have accommodations, you need to let me know, like right now. So that way I can make sure Dr. Brown has that all set up for you guys on the exam piece for your accommodations. So be sending me those letters if you have them. They will also need sent to Dr. Brown. Okay. And if for some reason you want to take your exam on campus with a faculty member, then you have to let me know at least 72 hours before that exam is due to be taken. Okay. Like I said, the exams are typically Zoom proctor. You have to be on camera the entire time. You have to show me your photo ID. I will check your surroundings. Your ears cannot be covered. Okay. Missed exams, you will have a week after, but you have to let me know prior that you're going to be missing it. Okay. And essentially it has to be a very significant reason on why you're missing that exam. Okay. And it has to be more than 24 hours before the exam that you're going to let me know you're missing it. Okay. Yeah, basically stay in communication with me. I'm not a scary person. I'm here to help you be successful. So if there's something going on, let me know. So for your quizzes, you will go through Canvas. You'll click quiz 1 when it's time to do that next week. I will let you know, and then we'll start from there. Once you start it, you have to complete it, okay? If you're having technical difficulties during a quiz or an exam, do not try to just push through. Let me know right away, okay? And then I'll try to work through it with you. And if not, then we can talk about something else, okay? Your specialty exam, so that's your HESI, it's given proctored. So typically on campus or via ProctorU, I haven't had any students not do it on campus. But you know, each campus is a little bit different. You only have one attempt with your HESI, since it's peds. You'll have an assigned date and time for the exam. Usually you want to try to sign up for the Monday morning time if your campus offers that, okay? Your HESI is 20% of your grade, okay? And you want to shoot for at least a 900. You have to do remediation no matter what grade you receive, and it's based on the score that you get is how many hours of remediation. It has to be done by Tuesday at 1 a.m. of week 12, okay? If you're not completing the remediation, then it's a 0 for your HESI. We've already talked about that, exam security. If you have any problems or would like extra help, let me know. Once again, planning out your time to be successful, look at your syllabus and the announcements. See what you're having to do each week. You can also look at your calendar, okay? You can write it out on your own calendar, whatever works for you to try and stay organized and prioritize, you know, what you need to do each week, okay? Make sure you are doing the readings, especially in this class, okay? And then submit your work. This is a way that you can try to organize, just map it out on your calendar or your planner. Late work, like I said, it will not be accepted without letting me know prior, okay? And me saying, yep, that's okay. So you have 7 days to do your work with a 10% deduction. If it's, you know, 7.5 days, that's a 0, okay? Purpose of the NCLEX practice exam is to prepare you guys to sit for the actual NCLEX and also to help with the HESI. So making sure you are taking those seriously. Here is how you will do the NCLEX questions, okay? You will have to post a PDF, okay, for those to be helpful. This walks you through exactly how to do that. You can do the questions as many times as you want, but once you submit that PDF screenshot to the course, that's the grade you're getting, okay? So you can keep doing it and then just upload when you have your best grade, okay? So just a screenshot that's not a PDF, I'm not going to be able to open those. You guys have to do 50 questions on these as well, okay? Follow your instructions, use those step-by-steps. Like I said, this PowerPoint will be in the week 1 announcements, okay? HESI assignment and practice exams, these are 2 separate practice exams, okay? You have to go through the course module in Canvas to get to these, okay? If you just log directly into your Evolve account without approval through Dr. Brown, then you guys will not be able to get credit for that, okay? No, the assignments are not, they're not open super early, okay? Most of them are open maybe a week ahead of time. And then screenshots. No, I said screenshot PDF. I mean PDF. Okay. For the NCLEX practice questions. Okay. Your NCLEX practice an assignment or assignment exam will automatically transfer from Evolve into the gradebook. If there's some issue with that, then let me know. These are on time, on a timer as well, so they're due by midnight on Sunday. So if you guys go in and do these late, then you'll get a 0. Okay. CJ Sims. Okay, these are screenshots. Okay, it has to be readable. I have to see your name. I have to see the date you did it. Okay, and the name of the patient and your score. CJ Sims are screenshots. NCLEX questions are PDF. Okay. Paper assignments, we won't do those this term. Okay. With your discussion questions, use APA. You can utilize Purdue OWL. That's a really good website. PurdueOwl.com, I think. Or if you just Google Purdue OWL, that is really helpful for your APA. Use only nursing journals, okay, for your review or your book. They shouldn't be more than 5 years old. Okay. And then cite your source within your post and then also at the end. Okay. Okay. Here's questions to be thinking about throughout the course. How can you maintain your professionalism if you're not a part of a hospital-based system? Be prepared to discuss how care is continued once the patient is discharged. So be thinking about these things throughout the course. Okay. Okay, hang on, you guys have. Yeah, so save it as a PDF and then upload. Yep, exactly. For the NCLEX questions. But for your CJ Sims, you guys, it won't give you the option to save as a PDF, so you'll have to screenshot it, but just make sure that your guys' name is on there, your patient's name is on there, and the date that you guys did it and your score. Okay. Otherwise, you guys will not receive the credit. Any questions about the orientation PowerPoint? I know it's kind of a lot. Basically, the biggest thing is stay in communication with me and you guys will be just fine. Okay. Alrighty, let's go to the material. Okay, do you guys want to do a Kahoot for this week? Do you want to go through the PowerPoint? Otherwise, I also have like a little Jeopardy thing that we can see how that works. Last time it wasn't the most smooth, but we can sure try it.
Can we do the PowerPoint and the Kahoot, please?
Okay, yeah, we can see if we can do both, but do you want to start with the Kahoot first, or do you want to start with the PowerPoint first?
PowerPoints.
PowerPoint. Are you guys good with doing that? Yeah?
I am,
okay.
yeah.
Okay, perfect. And like I said, if with the way my computer's being wonky with PowerPoint, if you guys have a question and you've chatted me and I haven't seen it, just unmute and ask, okay? Okay. right, so this week we're going to talk about infants and toddlers growth and development, okay? So, sorry. Okay, chapter 15 through chapter 17 is this week's reading material, okay? Here are your course objectives. This is what you need to know for chapter 15. With your study guides, I guess I touched on those briefly being posted in each of your announcements each week. So the bolded material is what you should be looking at for the quizzes, okay? And everything else on there will be like kind of what to know for your exams. So if there's something on that list that you're confused about, you're not sure, or you're like, gosh, I don't remember reading that, go back and read that material, okay? Okay, so child development. So development is a progressive increase in the function of the body. There's two different types, cephalocaudal, which is head to toe, okay, and proximodistal, which is midline, okay, out to the periphery, okay? So from the center out is proximal distal, and cephalocaudal is from the head to the feet, okay? Growth, this is an increase in physical size. So it's looking at their length, their width, their height, all of those sort of things. Feet, meters, their weight, kilograms, pounds. Most hospitals are going to do meters or centimeters for length or height, and weight is going to be in kilograms, okay? Maturation. So this is the total way that in which the person grows and develops, okay? So this is the growth piece and the development piece all in one. That's how you mature, or that's how maturation occurs. And this is based on typically an inheritance pattern from parents. Okay, so differences between adults and children. Children are not tiny adults. I know people hear about that a lot in peds, like people who aren't like really thrilled about taking peds will just say, oh, they're just tiny adults, so why do we have to take another course about it? Things like that. But children are not tiny adults, okay? They're children. So you have to think about them in a little bit of a different way than you would the adults. Growth and development throughout childhood is a continuous process. It doesn't just stop, okay? There might be some growth spurts where kids have a giant amount of growth and then it kind of drops off and levels off, which is a plateau. But kids are continually growing even into adolescence, okay? It's measurable, it's observed, and it can be studied, okay? And not everything matures at the same rate or at the same time. Not everybody grows at the same rate or at the same time. There's kind of a range on everything, but just to reassure parents that that can be normal, okay? Developmental needs obviously have an impact on that child's response to if they become ill. So if they're developmentally delayed and they're not having their needs met, then, you know, it's probably likely that that kiddo is not going to do as well if they have an illness, okay? You as a nurse must know what's normal and what's abnormal. And if there's something abnormal, you need to then come up with a plan, okay? So if there's something abnormal, your plan would probably be let your provider know that, you know, this was a concern or this seemed different than typical, okay? Anatomy and physiology is different in a child, like I said, than with an adult, and their responses to those illnesses and the treatments are also different. Not always, they might be similar, okay, but they're still going to be different. Like kids' treatments, medication-wise, they're going to be weight-based. We don't do that so much with adults. The nursing process, you have to apply that to growth and development. So your data collection, that's going to be your height, your weight, plotting on your growth chart where that kiddo falls in their percentiles on their growth chart. Recording your developmental milestones related to that child's age, that's a part of your data collection. And then just observing the child, the infant or the toddler, and interviewing those parents. That's all a part of your data collection nursing process. The next step is your analysis and your nursing diagnosis. So you're going to use your data collection and your interview and all of that, and use that to analyze and come up with a nursing diagnosis. Okay. So it could be related to parenting, it could be related to coping skills, it could be related to, failure to thrive, so they're not growing. It could be related to developmental delays. Okay. And then after you figure out your nursing diagnosis, then you come up with a plan. Okay. Most of that is going to be guidance or teaching to the family or to that child, or interventions to meet that child's developmental needs, or if they're failure to thrive or something like that, coming up with a plan to get them back on track. Okay. Implementation then is doing those interventions. Okay. So age appropriate self-care would be something that would be good for promoting, development and growth in kiddos. Anticipatory guidance to give parents a heads up on, maybe why they are seeing some behavior changes or changes in eating habits while they're hospitalized, or, their kiddo not being as social as they were before. So working on implementing then what you've planned. Okay. And then you're going to evaluate. It's a continual ongoing process of evaluation for growth and development. And then, if you feel like you're reevaluating it and parents maybe aren't understanding, then you're going to teach them again. Okay. Sometimes home visits are also necessary in your kind of ongoing evaluation process. Okay. So, let's see. You guys. Goodness, I'm going to get rid of this now. I'll lose you again. We're going to open up. I'll just open up the CJ Sim. So I'll open it up and then we're going to work through this.
Hello, everybody.
Oh, goodness.
Thank you for joining the Nurse Thinks CJ's.
I don't need the tutorial video. Let me pull this up really quick and then we'll work through the CJ Sim together. Have you guys done CJ Sims with other classes?
Yes, I have, yeah.
Okay, so I'm going to share my screen. We'll see if it'll share better with this. Okay. And then I'm going to turn up my computer because that's how you guys are going to hear this. Okay, so we're going to work through the nursing process with Joey Chung. She is 8 months old. Okay, so we're going to listen to what the mom has to say first.
This is our 6-month visit, but she's already a little over 8 months. I know we were supposed to come a couple months ago, but we just got so busy with work and stuff. daycare let us know that we needed an updated vaccine record. Can we get that from you today?
Okay. So data collection, right? That's going to be your first part. So what are they there for? What's their reason for being there? And you guys can just unmute.
Vaccine record. Vaccination.
Their profile.
Checkup.
Yep. Yep. Good. All right. Then what's your next steps? Oh goodness, why did it? Sorry. Here. Come on. Struggle is real today for this computer. Okay, so what would you start with for your data collection?
Their weight,
Uh-huh.
their history,
Uh-huh. So their history would be they're here for their 6-month checkup, right? That's their chief complaint. That's why they're here. Their weight. What else would you get for measurements since she's 8 months old?
The head circumference
Yeah.
and vitals.
Uh-huh.
Vitals.
Yeah.
Length.
Yep. Good. What else? Maybe a developmental milestone
Yep.
checklist or something. See if they're rolling front to back. At 8 months, she should be probably sitting by herself. Okay.
Like muscle tone and stuff.
Yep, exactly. Good. And then your analysis. So let's say everything's looking perfect. Okay. She's sitting by herself. All of her measurements are on track. So what would be your analysis then?
She's hitting her milestones.
Yeah, she's meeting her milestones. Yep. She was what, 2 months behind on her 6-month checkup? So maybe could our nursing diagnosis be potentially related more towards maybe is there a parenting kind of struggle going on, or like does mom need some help with something?
Yeah, the parenting, the coping skills, and the maybe some needs that were not met.
Yep. Yep. If she had developmental needs that weren't met, then we'd be talking about those. And then, okay, so let's say parenting. Let's say mom just started a new job and that's why she's 2 months late or something like that. And she kind of put the well child to the wayside. Okay, so what could we plan, or what could our family teaching or our anticipatory guidance then be with this kiddo? Related,
Like nursing teaching to the parents about how important making these appointments, meeting these appointments on time are very necessary to your child's development and health.
yeah,
And because now she's probably missing her shot from the 6 months, so she's behind now on the immunization.
yep, exactly. Good. And then how will you then implement what you talked about with the parent? How will you make sure that that gets done? What's a way that you could do that?
Would you like just send reminders of the appointment?
Yep, you could do that. You could have them schedule before they left for, then their next appointment, have them schedule.
And we can have the office maybe send out a reminder text or something too to help the parent, a call. Yeah.
Yep, good, perfect. And then how would you evaluate it? if it was effective.
If they showed up.
If they showed up, exactly. Good. Good, good. Perfect. Okay. So that's kind of a quick little breakdown way, easy way of how you can try to use the nursing process. And you guys should be trying to utilize the nursing process in almost all of the things that you guys are doing as nurses, okay? And your nursing process is similar in both adults and kids, okay? So that is one thing that's similar. Okay, now I'm gonna have to go all the way back through. Bear with me. Okay. Good. So assessment tools. So there's different developmental screening tools that you can use. The one that we read about the most in the book is the Denver Developmental Screening Test. This looks at developmental statuses and stages of children during the first 6 years of life. And it looks at 4 different categories. Looks at personal social development. So are these kids interacting with each other? Do they have communication skills? Do they have some words? Play, that sort of thing. Fine motor, adaptive, which means are they making really fine movements like coloring or brushing their teeth or stringing beads, as they get older. Language development, and then gross motor, okay? So the purpose is to identify kids who are not able to perform that age-specific level, okay? It's not an intelligence or an IQ test, okay? It's just, are these kids doing what they should at this age? These are usually done by the nursing staff at Well Child Checks. So influencing factors that can influence growth and development. Hereditary. So if, parents had developmental delays, then it's not unlikely that their kiddos, one of their kiddos, all of their kiddos may have some developmental delays. Nationality and race, that can be a factor potentially, with just different beliefs and different focuses based on their nationality or based on their race or their beliefs. That can kind of be factors potentially in their growth and development. Position within the family, that can be a factor. So, if parents are really focused on their parents, taking care of their parents, then the child's growth and development may not come along as quickly as a parent who can solely focus on that kiddo. Gender, so boys a lot of times are a little bit more developmentally delayed than girls. So that can be a factor. And then of course, environment. If their kiddo is in a good, loving environment where they have a lot of attention, then it's less likely that their growth and development are going to be delayed. But if kiddos are maybe in an environment where they have 6 other siblings and they can't be focused on and solely or as individually, then that can be a factor in their growth and development as well. So family structure, this is broken down really well in the book, so I'll let you guys read about that and the different kind of family structures and how that can influence growth and development. Parenting styles. Okay, so different parenting styles can definitely be a factor in influencing growth and development. So authentic is someone who's nurturing, affectionate, they have boundaries, they discipline through guidance, and they have an open line of communication. So that's one parenting style. Authoritarian is another form of parenting style. These people are very inflexible. They have high expectations. They're punishing over discipline, and they're very strict. Indifferent parenting style, this is kind of they're emotionally detached. They don't really have any rules or boundaries. They're kind of more interested in their phone than interacting with their kiddo. Okay. And permissive, these are parents who are nurturing, affectionate, but they have inconsistent boundaries and they're kind of wanting to be more of a friend than parent. Okay. And discipline should focus on teaching them to, not make that choice again versus punishment. Okay. So for example, timeouts. Timeouts should be utilized 1 minute for every age or every year that they are in age. So if you have a 5-year-old, then their timeout time is going to be 5 minutes. Doing anything more excessive than that is not really that helpful. And then I always tell parents at the end of timeout, try to communicate with them what you expect from them in the future. That's a good way to kind of let them know that, hey, next time this happens, this is what we expect. A way to kind of give them boundaries. Nutrition. So if kids are not eating enough to maintain their growth and development, then obviously that's going to be affected. So nutrition provides heat, it provides energy, it helps build and repair tissues throughout the body, it regulates the body process. It needs to be a mixture of fruits, veggies, grains, proteins. Okay, all of those things should be involved in their nutrition. Kids are really super picky, especially toddler age kids. So veggies and fruits sometimes can be a struggle to get them on board with, but it should be something that parents are still offering. Okay. Water, minerals, compounds, vitamins, things like that should also be focused on as well at this age group. So some families don't consider food a priority. So like taking that into effect, that kind of goes along with their heritage. So if they are of an ethnicity or heritage or a culture that does not focus on food being something that's necessary per se, or like the first priority, then these kids a lot of times can have developmental delays. If kids aren't getting an adequate nutrition, then they can be more likely to have mental retardation or decreased motor skills, or maybe struggle with peer relationships as well. Okay, so overall, their growth and development will be affected. Okay, if you identify a kiddo who's at risk for this, then try to work on modifying those family eating habits. Okay, so those kiddos are getting adequate nutrition. Okay, how does cultural food influence affect the child's or infant's nutritional intake? And then tell me how you could educate those parents.
Maybe they don't like it and they won't eat it.
Uh-huh. So if a kiddo doesn't like it and they won't eat it, what could you tell parents to do?
Find stuff they like to eat, basically.
Yeah, but most kids probably don't like to eat veggies, right? Toddlers.
You
They
gotta
have
make
to try
it to
to
main.
modify a way to fix it, so maybe they won't even know that it's vegetables
Right.
Some
in the
people
food. I
they've
mean,
made like mac and cheese with veggies that are colored like the mac and cheese, and the kids don't notice it.
Uh-huh. Or like I've had some parents do like smoothies with fruit but also veggies in it, so and the kids didn't necessarily know that they were getting veggies, just some other way to get that in them. Because if you as a parent, or you're encouraging parents to just make what they like to eat, then kids are going to get really picky with their preferences, and sometimes that's harder to undo than it is to just kind of push through and try and figure out how to get them their nutrition that they need.
Can we
That makes-
just show example, like when parents eat also veggies consistently
Uh-huh.
and provide different choices, like put all different colors and
Yep.
just do it every day.
Yep. Yep. Good. And from the start, that makes it easier to do it that way too. Yep. It makes it a lot harder if you start with giving them their preferences. Yeah, good. Okay, so nutrition and health promotion, obviously by promoting health and nutrition, it's hopefully the goal is that it prevents diseases, okay? It is not recommended that kids go on diets or significantly reduce their fat or cholesterol or calorie intake, okay? Because of the development of their nervous system and the rest of their body system that is occurring during childhood, okay? If there is a severe illness, then that's when you look at, and kids aren't eating or they're not allowed to be eating during a hospitalization or something, that's when you look at doing enteral feeding, so NG tube feedings, or G tube feedings if it's going to be a long period of time, or something like total parenteral nutrition, so TPN, through their IV lines or their PICC lines, central lines. To allow those kids to be able to get enough nutrition, okay? Some of these kids may be destined to just have a G-tube due to something developmentally that's going on with them or physically that's going on with them. So you guys as nurses will have to support parents through that and help kind of work with them on that, okay? So feeding the ill child, obviously, if they're hospitalized, they're not feeling well, it's not going to be unlikely that these kids are not going to want to eat like they typically do. Okay. So making sure that, you know, they're getting appropriate nutrition. So keep track of what their eyes and nose are, keep track of what they're eating, making sure that they, you know, have teeth that they can eat, you know, the steak that they ordered, or which, I mean, most kids probably don't order steak, but you know, what they can, what they're ordering that they can actually physically eat, making sure that they don't have any lesions in their mouth, like hand, foot, and mouth or something, that those lesions are really painful and that's why they're not eating, or their throat really hurts. And, you know, they haven't had Tylenol or pain medicine for a while. So trying to kind of work with the parents and that child on, okay, how can we get them to eat? Okay. Maybe their parents aren't there and that kiddo has a hard time eating or feeding themselves. Okay. So you as a nurse need to go in and help feed them, or your nurse aide or somebody needs to go help feed them. Okay. A tablespoon of food for each year of age that child is a good kind of rule to follow. If they're eating less than that, then you really get concerned about, you know, them not getting enough nutrition. Infants, if they're on NPO status, then they should be getting a pacifier. Also, if they have an NG tube feed or they have a G tube feed and they're an infant, pacifier to try to continue to promote them sucking to be fed. Okay. Obviously not giving kids treats or snacks or sweet drinks, sodas, things like that right before a meal is also helpful. Sometimes kids, when they're sick, older kids, I feel like this usually happens more. You know, they start refusing foods as a means of trying to get their parents to get them something else, or you know, get them, manipulate the parents in some way. Okay. Childhood obesity, this is a huge struggle. This is why nutrition is probably one of the biggest parts of peds now, to focus on nutrition. Kiddos are growing up with parents who are obese and watching those habits. So that's one factor, I think, is just teaching healthy lifestyle choices related to food and teaching that to those kiddos too. And also healthy lifestyle choices in the form of exercise. Okay. So childhood obesity has increased by more than double over the past 30 years. Kids ages 6 to 11. In 1980, it was about 7% of kids that were obese. Now it's in 2010, it was 18%. And now I'm sure it's much higher than that in 2025 or in 2024. Like I said, it correlates with obesity in adulthood, because now people who are obese in adulthood are having children, and the people who are having the parents have gotten used to kind of eating a certain way. So we can see adult health problems in children who are obese, like high cholesterol, high blood pressure, diabetes. We are starting to see more of that in kids, unfortunately, because of the obesity rate. So focusing on activity is a big piece, and then also making sure that they're getting fruits, veggies, real foods, not processed foods, not fast foods all the time, things like that. To calculate your BMI percentile, there is your calculation there. For BMI, for kids, we look at the percentile versus the actual BMI number itself, okay? And 5th to 85th percentile are normal, healthy BMIs. Less than 5th percentile is underweight. So from 85th to 95th percentile is overweight. And then greater than 95th percentile is considered obese. Okay. Okay, here's a critical thinking discussion. You have a 6-year-old patient who's come to the clinic for their annual school checkup. Her mother states that the child does not like to eat, and she believes that the child's underweight. She is concerned that the child will become ill if she does not eat. What assessments need to be done in order to determine the best course of action for the child? Okay, just unmute.
We have to get the baby's weight.
Yeah, the kiddo's weight. Yep.
Iron.
Food assessment.
Yeah, make sure like you said, her throat isn't hurting and stuff like that.
Yeah.
Just to assess her, like is there any teeth, are her teeth bothering her? Are there any lesions, anything in the mouth like that? And
You can also see if it's something as simple.
Oh, sorry. Go ahead.
You can also see if it's something as simple as maybe the kid just doesn't like that food.
Mm-hmm.
That's why they're not eating it.
Mm-hmm.
Iron deficiency.
Yeah. Good. What else?
Sometimes if all of that comes back normal, you could possibly need like maybe an upper GI to see if things are moving down properly. That kind of thing.
Mm-hmm. Yeah. See, maybe they're right.
I was
gonna say ask about pain in the upper GI.
What would be the first step that you guys would do to answer the mom's question on if the child's underweight?
Calculate her BMI.
Yeah, so get her height and weight, right? And see where she's falling on her growth chart and her BMI percentile chart. Yeah. So that's one assessment that you could do. And then, yeah, your assessment with making sure that, she's not sick or something that's causing her to not eat as much. What else could you do?
You're going to do food preference, like what's preferred, the most preferred food.
Yeah, you could also do, but what about for the assessment part? So instead of doing that as an intervention, how could you check and see, what types of things she's eating?
You'll have mom give you like a list.
Like a
food choices or food she's eating and not eating.
Yep. Or like what she typically eats in a day, something like that. Yeah, good. Yeah, checking mental status. That would be important too, to make sure she's with it enough. Good. So oral health. So oral health can also be a factor in growth and developmental delays. So if baby teeth are neglected, then it's not unlikely that they may not eat as much because their teeth are hurting. Okay. And then if those baby teeth are lost too early, the permanent teeth, it's going to take longer for those to come in. And a lot of times they're going to come in more crooked, or something like that. So it's going to be harder for those kiddos to eat, without those teeth as well. Okay. Okay. And if kids are losing teeth really early or losing teeth really late, or they're coming in really late, that can be suggestive of an endocrine disorder or other pathologic conditions. So something like diabetes, or specifically like type 1 diabetes, or like a growth delay, a growth hormone delay, something like that, or an issue with their endocrine system. Okay. Oops. So oral care, so sticky foods, so things like gummies, sugary drinks, all those things, try not to allow kids to have those, just because, that sets up the perfect storm for dental carie or cavities. Okay. So dental caries, same thing as a cavity. Okay. So instead of offering, poor junky snack foods, you can offer things like sugarless gum, raw veggies, cheese, milk, fruits. Okay. Encourage parents to brush after each meal and snack if able, but for sure at least twice a day. Also encouraging parents to floss kiddos' teeth from an early age is really beneficial too. Okay. And by eating a healthy, well-balanced diet of fruits, veggies, meats, real foods, that's going to improve their tooth development. So here's a picture of your dental caries. Okay, so these are really bad dental caries. These typically happen when infants fall asleep while breastfeeding, or they go to bed with bottle or a juice. And then, that just sits, the sugar from the juice or from the milk or from the breast milk kind of just sits on those teeth and pools there. It's most commonly seen in kids, 18 months to 3 years of age, because this is when they're still wanting a bottle or milk or something like that to go to bed. Okay. So letting parents know to not do that, and for the last thing to be doing before they go to sleep is brushing their teeth. Okay. So that way they can brush all I call them sugar bugs off of their teeth before they go to bed. Okay. Your education on tooth hygiene, actually on this PowerPoint, it says starts with first tooth eruption. In my opinion, it starts before, like when kids are teething. Okay, you should be talking with parents about, using a wet washcloth to kind of rub their gums and kind of get used to them having fingers and, brushes in their mouth. Okay, brush before bedtime. That's the biggest concern, is that it should be done before bedtime. Okay, because all of the sugar bugs from throughout the day just hang on in that saliva, and then your saliva that is bactericidal or kills off some of those sugar bugs, that decreases during sleep. So it's more likely that the sugar bugs can kind of accumulate and cause those caries during sleep. So making sure that they're brushing teeth. Okay. So fever is not associated with teething. Okay. So teething does not cause significant fever. So you should be looking into the reason why that kiddo has fever. Now, not to say that kids don't get a lot of viral illnesses like RSV or things like that while they're also teething. Okay. So parents, I feel like a lot of them come to me and say teething, they have a fever, automatically it's teething. Well, you have to check into other things because a lot of times it's not just from teething. Okay. It's okay that it can't come off. I don't know. I'll try and see if I can get it off too, but I don't think it'll let me. Whoops. Nope, it's not gonna let me. It's no big deal. Okay. So replace their toothbrush every 3 months. Okay, or after they're ill. Okay. Or this says just viral illness, but strep throat. When they're on their antibiotic, 2-3 days in, they should be getting a different toothbrush. Otherwise, they're going to keep getting strep over and over and over again. Okay. Do not close the container of the toothbrush unless the toothbrush is totally dry, because then that sets up for bacteria and things to grow and breed in a moist area. And then encourage kids to not share toothbrushes. Okay. All right. So another critical thinking question. When performing assessment on a 2-year-old, you observe numerous nursing caries in the child's mouth. So that's just from breastfeeding. Okay. What kinds of recommendations or teaching should you as the nurse provide to the parents? So let's start with that. What should you teach or what should you recommend those parents to be doing?
Limit the sweets and brush after every meal.
Yeah.
Diluting sugary drinks.
Yep. No sugary drinks. Yep. She's nursing, right? So
Come off the bottle.
Don't fall asleep on it.
yep, not falling asleep while nursing. Brushing teeth after she's done nursing. Okay. Not having her nurse to sleep any longer, which can be hard for some parents. And she's a 2-year-old. What should she have done by age 2?
Taking her to the dentist.
Ding, ding, ding. Good job. That is a mega struggle for a lot of parents, at least here in Iowa where I practice, is their insurance does not cover dental visits. So that's like one of the last things, unfortunately, that happens. So it is not uncommon for me to have 3-4-year-olds with a mouthful of cavities in their dental, they've never seen a dentist. So making sure that parents are taught that starting at age 1, okay, is when kids should be going to the dentist every 6 months. They're not going to at age 1 get a huge thorough workup, right? But their teeth will at least be examined. Okay. Okay, so we talked about what recommendations and what teachings you guys could do. Now, what are the dangers of if that's continuing to happen, that the kiddo just keeps getting dental caries?
They have to get the teeth removed, pulled out.
Yeah.
They're also could be in a lot of pain when they're eating, so then they're not getting adequate nutrition because they're in pain.
Good. Yeah. Good. Okay. So more influencing factors in growth and development. Play. Okay, so play is the work. That's their job as children, is to play. Okay. In play, that's how they're going to learn. That's how they're going to socialize with others. That's how they're going to explore their world. That's how they're going to learn to manipulate their environment and understand their environment, is by play. So hospitals that are used for children, a lot of them have playrooms, okay? So if kids do not have a communicable disease like a draining wound or RSV or COVID or something like that, then they can go to those playrooms and they can play with other kiddos that are also hospitalized. But if kids have some communicable disease, then a lot of times what you can do as a nurse is bring them some sort of activity for them to do that's age appropriate. So that way they're not losing out on the play piece of their childhood while they're hospitalized. So if it's an older kiddo who likes arts and crafts, you can bring them arts and crafts. If it's a kiddo who likes doing, like PlayStation games or something like that, they could do that for a little bit of time. They could watch a movie, if they're a teenager, usually that's kind of more what they'd rather do, that or play on their phone. So, do some things so that way play is still happening when these kids are hospitalized. Obviously, age appropriate and developmentally appropriate toys. So if a 2-year-old's developmentally delayed, like a 1-year-old, you know, they're where a 1-year-old should be, they shouldn't be getting 2-year-old toys. Okay. You should be looking at giving them more 1-year-old toys, safety preference wise. Okay. If kids have, like a kiddo has asthma, don't give them stuffed animals, because stuffed animals, what does that do? That traps the dust and the fuzzies and all of that. So you take that into a kiddo with asthma, and sometimes that can, you know, the dust can kind of trigger an asthma flare up. So be thinking about that stuff too. You know, what is this kiddo hospitalized with? Is this toy going to, you know, amp that illness kind of response up, essentially? Okay. And parents, you should be teaching parents to make sure that those toys are, you know, if they've had the toy for 3 of their siblings, and now the 1-year-old's playing with that toy, make sure that, you know, the little pieces are all still on the toy, secured in a way that that kiddo can't get those pieces off. And then also making sure that parents are purchasing toys that are suitable for those kiddos' age and their kiddo specific abilities and skills. Okay. Tell me which toy an adolescent would enjoy.
The pool table.
Oh, pro table.
Yep, the pool table. Yep, good. What about infant?
The egg toy.
The
Oh
block.
no, oh, whatever this is right here, the little.
The book.
Oh yeah, book.
Yep,
Oh,
yep, the little fold out books. Yep. Because an infant, think about an infant is 1 year and under. Okay. So some of this, like these egg toys, maybe like a 9-month-old or so could play and manipulate those. But probably this is going to be more toddler age. Okay. This is going to be more like preschooler age. Okay. But building towers, stacking blocks, things like that, school agers can do, but they're starting that at preschool. Most school agers are going to be probably more at the little learning book, learning to write. Okay. Good. Okay, chapter 16, infants. Here are your course objectives. Know these. Make sure you have read. Okay. Parenting skills with infants. So this kind of goes along with the parenting types that we talked about just in general growth and development, how that can affect their growth and development. So infants, some of them can be really fussy and irritable. So if parents are kind of fussy and uptight and seeming irritable, those infants are going to feed off of that. So it would be important to encourage parents to try to be calm and alert to their infant and respond to their infant, but also try not to like overstimulate the infant. Recognizing infant cues can be a big thing if parents are brand new parents, you know, them kind of rooting around trying to eat. Parents might not recognize that as a hunger cue, and then all of a sudden the baby's screaming their head off, crying because they're really, really, really hungry, and then they're not going to eat as well. So helping parents to recognize some of those cues. Oh, hey, maybe my baby's getting hungry, so I'm going to start getting the bottle ready, or hey, I'm going to start breastfeeding or pumping or what have you, prior to that baby getting extremely worked up and not eating well. Sitting quietly, singing, talking to them, talking in a soft voice, changing the infant's position slowly, right? Not just kind of flopping them around. Shushing can be helpful if they're starting to get worked up. Laying them, and you can actually see mom kind of laying the baby on their tummy on their side here, and like gently kind of rocking and shushing at the same time can be helpful in calming those infants down. Not having a lot of overstimulation going on, like a lot of loud noises in the background and things, can also be helpful. So I kind of already talked about this already, so I'm not going to go back into that. Sleep patterns for infants. So newborn should sleep in about 4-hour intervals. Okay, this doesn't always happen. Sometimes it's 2-hour intervals, but newborn sleep wise, 4-hour intervals is usually the max you're going to get in newborns, which are going to be a month or less of age. Okay. By 4 to 6 months, your interval might be up to 8 hours if you're lucky. But it just takes time when baby's born to transition to extra utero life, and kind of getting that circadian rhythm involved, and working kind of with the family routine. Okay. So if a family has a really, really good strict routine, then that infant is more likely going to be a better sleeper. If they kind of just let the infant make the shots or call the shots, then, you know, the kiddo might have more awakenings during the night. Okay. Excuse me. Babies should be put on their backs on a firm mattress. There should be nothing in their crib with them. No little cutesy stuffed animals or like the little bumper crib rails. I don't care if it's mesh. I don't care if it has breathable things. None of that. Okay. It's not safe for them to have anything in the crib with them. A blanket, a pillow, nothing. An elevated bed or elevated little seat, none of that is safe. Okay. I don't care what the advertisers all say about safety and all of that. It's all baloney. Putting them on their back by themselves in their own crib is the safest way for babies to sleep. Now, this sleep sack that this baby has, I'm assuming this baby must roll because their arms are out of their swaddle sack. That is acceptable. Okay. But other than that, nothing else in the bed. Okay. Parents will be concerned then that their baby's going to be cold while they're sleeping. Usually what I tell parents is one more layer than you are comfortable, the baby will be totally okay. Okay. So just give them another little sleeper or something like that. Okay. Parents will be relied upon to soothe the babies back to sleep if they awaken during the night. Usually, you know, they're awakening at early stages because they're hungry and they need fed. But, you know, as they get older and they're not needing fed in the middle of the night, if they're waking, you can allow them to kind of self-soothe. Okay. So you don't have to run right over there as the parent and, like, you know, make sure everything's okay. Immunizations, this is obviously a huge part of infancy and toddlerhood with health promotion. So you really need to stress as nurses the importance of the vaccines and the importance of the timing of those vaccines. If you delay them, then you risk exposure to those serious illnesses or death. And unfortunately, because people have gotten really leery, I think, since COVID, the COVID vaccine came out, we are seeing a lot more people refuse childhood routine vaccines. So we're seeing things like pertussis come back. We're seeing things like measles come back, varicella, chickenpox come back, mumps come back, things like that, we haven't seen for a really, really long period of time. Okay. So stressing that to parents too. I think some parents are like, why do I have to do that? We haven't had polio for 60 years. Okay, well, the reason why we haven't had polio for 60 years is because of the vaccinations. So just to kind of make sure that parents are getting accurate information, that's another piece. A lot of people are coming to me saying that they've read this on Facebook or that on Facebook. And you know, it's just it's not reliable. So sending those parents adequate information on the vaccines is really important. Also, keeping accurate records of your vaccines that those kids have received is really important. So that way you're not potentially duplicating or causing confusion if that child moves. Most states have like a vaccine registry that they have to enter the vaccines in that is accessible to the state. So if they move from one town to another, like in Iowa, then they should be able to look them up and see what other vaccines they've had somewhere else within Iowa. But there's no nationwide vaccine record keeping, unfortunately. Another health promotion, obviously infant safety. Car safety is probably the biggest safety focus that you should be focusing on as nurses and teaching parents. Kids younger than 2, okay, should be rear facing. Ideally, you max out the height and the weight limit on those. This says rear facing about 30 pounds. Most of them now are to 40, 50 pounds, even rear facing. Even if kids have their legs crisscross applesauce while they're rear facing, that's safer for them to ride that way than it is to be forward facing. So the biggest thing with car seats is the weights and the heights are all slightly different. So you'll have to tell parents that they need to look at their specific car seat manuals for those heights and weights, okay? But the best thing to do is tell them to max out the height and the weight on each stage of the car seat, okay? Fall prevention, obviously, never leave a infant on an elevated flat surface where they could roll off, or any sort of surface where they could roll off. Crib rails should be raised at the full height. That means when babies are in the hospital too, the crib rails should be all the way up. I don't care if it's a 2-week-old baby, you know, and they can't climb, the crib rails should still be all the way up for safety purposes, okay? Stairways, pools, that's a big one, is pools, babies getting into pools as they're more mobile. You know, they want to go swim, they want to have fun. Toddlers, same way. They'll walk out to the pool, get in the pool, they can't really swim, and then they drown. So, you know, focusing on those teachings to parents. Toy safety, obviously, no small removable parts for kiddos that could be easily swallowed, okay? Stressing the importance of the periodic health checks, so the well child checks their vaccines that they need, any anticipatory guidance, things that they could expect developmentally that are going to be changing before that next checkup. So, you know, if it's a 9-month-old checkup, well, probably before you see them at a year, they might start walking along things. They might start, you know, using things to pull up to stand or standing by themselves. So safety things like that, teaching parents, you know, as kids get more mobile, their home needs to be infant proof and toddler proof, okay? Changing diapers as soon as it's soiled or wet, that's another important thing. I feel like some parents, because of the cost of diapers, will let kids sit in their diapers for a while, but then they wind up with really bad diaper rashes. So making sure you're teaching on that important, even though, you know, diapers are pricey, potentially, maybe they need to look into cloth diapers or something, okay? Monitoring their growth and development, that's a part of their periodic health checks and that importance, and then making sure that they're maintaining adequate fluid and nutrition. Physical exam wise, so these kids will be seen at least 5 times in the first year. So ideally they're seen at birth, right? So shortly after they're born for their newborn checkup, and then usually 2 weeks or 1 month. And then they're going to be seen at 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 2, and then 2.5, and then it goes yearly after that. So 3, 4, 5, and then each year, okay? So that's your, like, for your well child schedule. Immunization wise, kids will get vaccines First, they'll get their Hep B vaccine at birth if they're on the typical schedule. They'll get some vaccines at 2 months, the same stuff at 4 months, and the same stuff at 6 months. Okay. They'll get a little break as long as they're on time with their checkups at 9 months from vaccines. And then they'll get more vaccines at 12 months, 15 months, and 18 months. And then they should be done until they're 4. Okay. There's different screening tests. So hemoglobin and lead level checks, things like that will be done. Vitamin D or iron checks, looking at their growth charts, and then talking with parents about like anticipatory guidance things. Hearing and vision checks too as they get older. Obviously you can do hearing tests with the brand new baby. So if they fail their first hearing test, they need to repeat, okay? Okay, developmental milestones. So this can be done at various stages, at various ages, but the normal range is kind of what you guys are going to need to focus on, or the norms, right? So you have to know the normal range for each milestone achievement. In your books, there are some good charts, and you guys will just have to know these, okay? So like, at what age kids should establish the sleep-wake cycle? At what age do kids start socially smiling? Okay. When do they start drinking for a cup? When is it normal for separation anxiety to happen? Okay. So knowing those things. Parents should not compare their child's development to other children. That means outside of their family and inside of their family, because each child will meet those milestones at different rates. Even children who have had the exact same parents and the exact same genetics and all of that, it'll be a little bit different, okay? So motor development. Your grasp reflex, that is when, okay, so that's in this picture. That is when, you know, babies, it's really cute. Parents put their finger in their hand and they grasp. Well, not to crush parents' dreams, but their baby's not holding their hand to be sweet. It's just a reflex that they have. That usually goes away around 3 months of age. Prehension, that occurs about 5 to 6 months of age, okay? And then that's something that is stepwise, usually goes away then and develops sequentially, okay? The parachute reflex, so this is the forward parachute, so they're falling forward and they reach out and they stop themselves. That is a protective mechanism because they're going to be learning to walk, right? So that's teaching them to, reach out and catch themselves. So that way they don't hit their heads or their face. And that happens around 7 to 9 months. Like I said, there's a really great chart in your book that will go through all of these too. The pincer grasp, which is the really fine grasp. This is, she's kind of grabbing a lot of those Cheerios or Apple Jacks all at the same time. So it's hard to tell if she's got a fine pincer grasp, which the fine pincer grasp is just thumb and pointer finger grabbing and then putting into the mouth or, putting it somewhere else. That should be established by a year of age. The gross pincer grasp, which is kind of, they use all their fingers to sweep and then grab, that should be refined by about 9 months of age. Okay. For promoting an emotional development in infants, obviously infants who are consistently cared for when they're crying, they're going to be less likely to have behaviors into toddlerhood, okay? Because they're going to know that their parents are there, their needs are being met, and they're secure, okay? If infants are crying for long periods of time and their needs are not being met, eventually they will get to a point where they stop crying, okay? Because They've gotten to the point where they know that their needs aren't going to be met. So what's the point of continuing crying? Okay. So those kids are going to be more likely to be stuck kind of in the infancy stage, okay, of development. Okay. When infants are seeming to want to learn something new, then parents should be encouraging them to learn those new things. Okay. So like when infants are starting to kind of want to walk, okay, or crawl, that should be encouraged. Okay. Do not force kids though before they're ready. For example, a good example of that is forcing kids, 2-year-olds, toddlers, to potty train when they're not ready. It's going to be very difficult, and then you're going to have a kiddo who has likely a developmental potty training delay. Okay. Okay, here's your chart of first year developmental milestones. This is not all inclusive. Okay, so you'll still have to read your book for everything else, but this is a good chart to be aware of. So their birth weight should double by 6 months and triple by 12 months. Okay, so by a year, they should be triple their birth weight. That's one quick way to know growth-wise if they're successful and if their nutrition's appropriate. Lengthwise, they should be 50% increased at 12 months of age from their birth length. Okay. Head circumference are equal, head and chest circumferences. If you take those measurements, they should be equal by a year of age. Their posterior fontanelle should be closed at 8 weeks. A lot of times it's closed before then. Their social smiles at 2 months. Turning to locate sound, that usually happens by 3 months. The Moro reflex, so that's the startle reflex. You know, like you grab the kiddo's hands and you slowly let go and they like startle. That's gone by 4 months. Head control, steady head control, not just a tonic neck reflex. That's gone, or that should happen at 4 months. Now you'll see parents say, look, they can hold they're 3 weeks old and look at how good they can hold their head up. Well, that's a tonic neck reflex. So it's not that kiddo's just got great steady head control at 3 weeks. Okay, that's a reflex. So still be encouraging them. Okay, yeah, that's awesome. That's really great, but that's a reflex. So they still at any point could, lose their head control. So encouraging parents to still continue to support their heads and their necks. Okay. They should be rolling both ways by 5 to 6 months, playing peekaboo by 6 months. Okay, maternal iron stores are totally depleted by 6 months of age. So those kiddos should be, that's when other foods are being introduced anyways, but letting parents know that kids can be low on iron starting at 6 months of age. Okay, that's where the fruits, the green leafy veggies, things like that are higher in iron should be implemented. Okay. Tooth eruption, that's usually starts around 6 months, but not always. There's a range on that. 6 to 8 months is usually what I tell parents before their first tooth. And of course, there's some kids that, at 5 months, they have their tooth come through. Normal stranger anxiety or stranger danger happens between 7 to 9 months. Then it goes away for a period of time, and then it kind of comes back between around 15 to 18 months. And those are normal things. So just let parents know that that's a normal developmental task. Okay. All the rest of these things you guys should be able to read. Okay, so infant theories. So Freud, your infancy 1 year to, birth to 1 year is considered infancy. So Freud's the oral stage. Think about what babies are doing. They're eating through their mouth. They're sucking with their mouth. They're learning about their environment with their mouth. Okay. So that's Freud. Oral stage is going to be infancy. Piaget, that's our cognitive theorist. Sensory motor period. So this is birth to 2 years is the sensory motor period. So infants, they're learning through senses, oral, right? Mouth, touch, taste, hearing, smell, and their reflexes. Okay. So that's sensory motor, that's Piaget's. Erickson's is trust versus mistrust. Trust versus mistrust is focusing on, so that's infancy, which is a year, okay? That's focusing on those kiddos having their needs met. If they're not having those needs met, then those kids are going to have mistrust. So they're going to be kind of stuck in the trust versus mistrust category, the infancy category. So that's that infant that cried and cried and cried and cried, and no one ever came, to feed them or to change their diaper. So they're stuck in mistrust. The infant that cried and was fed and cried and had their diaper changed and cried and was cuddled, that kiddo is going to form trust in infancy, and then they're going to go on to the next Erickson stage. Know your theorist for your first exam, okay? Make sure you know them inside and out. I'm sorry, you're just going to have to remember them. It's a lot to remember, but you're just going to have to memorize them, okay? The digestive system in a newborn is obviously immature, and it doesn't function fully until after about 3 months of life. That's why their diet should solely be formula or breast milk for sure for the first 3 to 4 months of life. Okay. Saliva is minimal, so they're not able to break down foods. That's another piece of it. Hydrochloric acid and renin in the stomach and trypsin in the intestines aid in the digestion of milk, but those things are not fully compatible or capable of digesting actual food yet. Okay. So based off the physiology of the digestive tract and how that's developing, that's when you look at introducing foods, okay? So solid foods can be added beginning around 6 months of age. So if a kiddo is 4 months and their sucking is mature and they can hold their head up and they have good up and down kind of chewing motions, then maybe you can start experimenting with some oatmeal or rice cereal or something like that around 4 months. But if they're not a mature 4-month-old, then I do not recommend that. I say let's wait until 6 months. Even if they're not a mature 6-month-old, so they still have their tongue extrusion reflex. So like anytime you put your food in your mouth, they're like pushing it out, shoving it out with their tongue, then it's too early to start feeding them. Okay. So determining that the kiddo is gaining enough based on their diet. So infants should gain 4 to 7 ounces a week during the first 6 months. If they're not doing that, then they're not being adequately fed. That's when sometimes you have to have those babies admitted into the hospital and, come up with a nutrition plan and making sure that parents are feeding them and mixing formula right and all of that sort of stuff. Okay. Infants should also have at least 6 wet diapers a day. Okay. That's another way to make sure that they're staying adequately hydrated and having an adequate diet. And then infants should sleep peacefully for, it says several hours after feeding. Now, depending on the infant, it might not be several hours, but they should seem content after their feeding, and they should get some rest between feedings. Breastfeeding and bottle feeding, human milk is what's best for kids that are 6 months and less. But I always tell parents, if human milk, if you can't breastfeed, that's okay. We just want baby to be fed. Okay. So, and to be gaining appropriately. So if moms cannot breastfeed and it's just not something that's feasible, then formula is okay. Formula is typically cow's milk based and they're iron fortified. That's what's recommended by the AAP or the American Academy of Pediatrics. However, they do have soy milk base. They have more broken down proteins that's not soy or cow's milk base. Now there's goat milk based formula. There's all kinds of things now, but typically what's recommended starting with first is the cow's milk based. Okay. No whole milk until after a year of age. Also, no honey until after a year of age. Those are the two things that you have to know that is not done under any terms or circumstances before a year of age. Okay. And no honey because of the risk of botulism. Okay. So contraindications automatically to breastfeeding. If mom has galactosemia, or the kiddo has PKU, or the mom's HIV positive, or the mom's undergoing radiation or chemotherapy or using illicit drugs, or being is somebody who has tuberculosis that's not treated, then those are obviously all reasons to not breastfeed. Okay. Self-bottle feeding, making sure parents are keeping track of those expiration dates on the containers, okay, of formula. They do expire, so making sure that they are keeping an eye on that. Making sure parents know how to mix it appropriately and store it, okay? And then that they're using clean containers to mix and store, that they're not heating the bottles up in the microwave, and don't save the formula that's left longer than an hour from a feeding, okay? Because otherwise it can grow bacteria and cause diarrhea. There are specific guidelines for breast milk usage too, that you can look on the CDC's site for, just so that way you know in teaching parents as well. Prebiotics and probiotics. So prebiotics are non-digestible food ingredients. These stimulate the growth of microorganisms, okay? And then it assures that there's a balance of bacteria in the gut, okay? Probiotics are protective to the GI tract, and that's used to treat diarrhea, okay? If kids are on antibiotics, they should be on probiotics, okay? That's one reason for probiotics to be utilized. Is during antibiotic use. Making sure to tell parents, though, to not give those probiotics within 2 hours of giving the antibiotics, because they'll kill each other off and then it's pointless. Okay. Developmental skills of feeding, like I said, usually from 4 to 6 months of age, the sucking should be more mature. Okay. They should be up and down chomping motions prior to you starting to feed them. Obviously, as they get older, then they should start feeding themselves, okay? Then they can start with, they have their fine pincer grasp, then they can start grabbing and feeding the little pieces to themselves, okay? There's baby-led weaning. There's all kinds of stuff now. Rice cereal is still recommended as the first solid food because it's the least allergic option. Do not mix cereal and baby food in a bottle with the formula. It's going to be too hard for them to suck to get it out, and then they're going to be really gassy. Small amounts, usually a tablespoon or a teaspoon at a time of the rice cereal. When they're getting a new food, you offer that one food 3 to 4 days in a row for a 1 week period. Okay. And then wait a week before there's another new food introduced, okay? Because otherwise, if kids start having some allergic reactions, you don't know which food caused which, okay? It used to be recommended to delay induction or introduction of foods that are common causes of allergies, like nuts, berries, eggs, fish. But they've gone away from that. So usually I just say, after 6 months, come up with ways that are safe for those kiddos to not be choking potentially on those items. Weaning, so infants, if they're looking forward to new tastes and textures found on the spoon, they may not want to be held close during feedings. They might start to bite The nipple as teeth are erupting, that's kind of ways that you can be aware that they're getting ready to kind of wean off their feedings, like their formula and their breast milk, okay? Should be gradual, just not like a overnight flip. No fruit juices, in my opinion, at all because of the risk of cavities, but they say you can start those about 6 months. Okay. Infants should start drinking from cups around between 6 to 9 months, but for sure by 9 months, they should be drinking from cups. Bottles should be gone by a year, but ideally before. Fat intake during during infancy. Infants have 3 times the more need for calories versus their kilogram for weight in adults. So these kids need fat and good, easy, digestible fats. Okay. So your breast milk or your formula. And then, as you add those extra things in by 6 months, the ability to digest fat from actual foods is present. Okay. Low fat diets should not be given to infants or children younger than 2 years of age. And really, honestly, dieting, like restricting calories and fats and cholesterol and all that stuff isn't necessarily recommended in any kids unless it's absolutely necessary because of their health status. Organic and natural foods, these do not contain additives. This is probably the best way to eat because they don't have the added herbicides and pesticides and fertilizers. They can't be injected with drugs or hormones as well, as far as the animal piece. But the nutrition in organic versus non-organic foods, it's not really been overly researched as a superior option, okay? But the thought is that without all those additives, you're getting more real foods with less additives. So ideally, it should be better for kiddos. Make sure you're reading food labels. Okay. Toddlers, chapter 17. Here are your objectives. Okay, toddlers is age 1 to 3. Okay. So once they turn 3, then they're no longer a toddler. They're preschool age. Okay. 3 to 5 is preschool. They're not as dependent on others. They're having rapid growth and development still, but it's slower than it was during infancy. Erickson's stage is going to be autonomy versus shame and doubt. Daily care, you want to promote independence. So these kids should be able to be dressing themselves. So, not having them have a million buttons on their shirt or on their pants to get their pants on. They're going to be involved in daycare a lot. Schedules need to be organized, but also flexible around the needs of the entire household. Guidance and discipline, usually at this age group, timeouts and setting limits is going to be your best thing to do. And like I said, 1 minute per year of age that they are old. Oh gosh. I swear it's not like this all the time. So like I said, it should be stressed that they are trying to promote their own independence. And a lot of these kids will be in daycare settings. So rules and expectations in those settings also can affect then guidance and discipline at home. Toddler age kids, they're seeking their parents' approval. They want they're kind of people pleasers usually. And the goal for their discipline is to teach and not to punish, okay? So when kids are in trouble and they're toddler age kids, parents should be getting down on their eye level and talking with the child. It's less overwhelming, it's less scary that way. So you as nurses, when you're going in to assess these kids, get down to their eye level. That will be less threatening. Also, trying to play with them to get them to allow you to assess them will be helpful too, okay? Parents' responses to temper tantrum can either reinforce the desirability of that or causes the behavior to worsen, okay? So making sure that you're letting parents know that it's okay to ignore temper tantrums as long as the kiddo's safe, okay, and not going to be hurting themselves or others. And then also, like I said, timeouts have to be a minute per year of age they are. Injury prevention is another factor for toddlerhood. It's actually probably more of a factor, I think, for toddlerhood than infants, because toddlers are more mobile and they're more independent, okay? So educating parents at each of those well-child checks of injury prevention kind of things that they can do. So making sure, you know, hot things, so like this panhandle isn't right there where they can just grab it and pull that hot water or that hot oil or whatever on themselves. So things like that. Outlet covers, of course, small little button batteries. Those are a huge thing that can come out of some toys or watches or things that should be really avoided. So federal government and private organizations regulate different infant and toddler items. So they've done non-flammable sleepwear for kids. You'll see those stickers or tags on PJs sometimes that they, you know, they need to be a small, tight fit to be maintained as non-flammable sleepwear. Child-proof caps on medicine bottles, temperatures being set maximum wise on the water heaters to reduce the risk of burns. The slat spaces in infant cribs have to be certain intervals, so that way, you know, if an infant puts their arm through it, it doesn't get stuck. Their car seats, their carbon monoxide and smoke detectors, all of those things are federally regulated in order to prevent injuries. And they also regulate with recalls and things if there are injuries that are found to be caused from those items. The rate of brain growth in toddlerhood slows. The body, the head, and the trunk are kind of growing more slowly. The body proportions are starting to be more equal. They're still going to have those protuberant abdomen. Okay, so they're going to have that more noticeable kind of almost descended or distended belly appearance in toddlerhood, but towards the end of toddlerhood, that kind of is flattening out, okay? Myelination complete by 2 years of age of the spinal cord, okay? Your muscle and bones are starting to harden, okay? Toilet independence. So this comes, typically kids could actually be potty trained physiologically at 18 months because of their anal and urethral sphincters being fully developed and having voluntary control of these things. But most kiddos are fully potty trained between 2.5 and 3 years. Boys, they kind of have a little bit more of a grace period. Those can be it can be acceptable for boys to take up to 4 years to potentially to potty train. If kids are constipated or something like that, that's going to factor into potty training. They're not going to want to go potty on the potty because they're afraid it's hurting. Also, sometimes you see some kids having a hard time separating from, you know, their bowel movements or from their pee to watch it go away. Sometimes that can be a struggle too. They feel like, you know, it's a part of them and it's kind of disappearing. So that can be a struggle of potty training as well. The biggest thing I tell parents about potty training is if kids are dry for 2 hours, they're more dry often in the morning after sleeping at night than they are wet. And they're 2 years of age, then you can start trying to potty train. If kiddos are straight up refusing potty training and not interested at all, then I tell parents to kind of wait. Okay. Sensory, motor, and cognitive development in the toddler. Their memory strengthens. They're going to start remembering things. They're still in the sensory motor phase of Piaget. After 3 years, they're in the preconceptual phase of Piaget. So they're kind of hopping from, the senses and learning their senses and interacting with their environment in that way to the preconceptional phase, which is where they land kind of more in preschool age group. They're learning through trial and error and repeating. Speech development, this parallels with cognitive growth. So if their cognitive growth is delayed, then it's not unlikely that their speech will also be delayed, okay? So comprehension exceeds verbalization. So what they understand is exceeding what they can tell you. So their expressive and receptive language continues to develop, but their receptive language, what they're understanding, is going to be greater than their expressive language. Toddlers, by 2, I tell parents about 50% of what toddlers should say, or of what 2-year-olds should say, strangers should understand, okay? And that is without like the kiddo pointing to what they're saying, okay? And then by 3, about 75% of what they say a stranger should understand without reference. And then by 4, completely everything that they say should be understood. If they're not meeting those categories, then they need speech therapy, okay? And then telling parents to be empathetic to their toddler who's trying to learn how to communicate verbally, because it's frustrating that they cannot, verbalize what they want to say. Screening for autism, this is done across the board at ages 18 months and 2 years, okay? So if they do not have any single words by 16 months, you're concerned of that kiddo having autism. If they're not waving bye-bye or pointing by 12 months, you're concerned about that as well. Or if they had some language skills and then they've lost it, they regressed, then that's concerning. Or if they're not saying 2-word phrases by 24 months, so by 2 years, then you get concerned. You also have to rule out the potential for those kiddos maybe not having great hearing, or maybe there's a neurological thing going on, or they have too much lead in their blood that's causing developmental delays, okay? So you have to think about other things too, not just specifically autism, but if you're noticing those things, you would get concerned for that kiddo having autism. Milestone for toddlers. So kids are at 2 years of age, you're 50% your adult height, which is crazy to think. Because that's how much growth has gone on during the first 2 years of life. Birth weight quadruples by 2.5. Okay. You're slowing with your growth velocity. It's going to be more of a steady. Kids will be bow-legged and kind of have that more pot-belly look to them. But as they're getting closer to 3 to 4 years of age, that they slim out. The anterior fontanelle, so that front soft spot, should be closed between 12 and 18 months. If it closes before then, you get concerned about, their head size not being large enough to support their brain development. Okay. Speaking in 2 to 3 word sentences by 3, 3 to 4 word sentences by, I said that wrong. 2 to 3 word sentences by 2, 3 to 4 word sentences by 3. They should be able to say their first and last name between 2.5 and 3 years of age. And just know and tell parents, temper tantrums are very common in this age group. They're kind of like a blender that you forgot to put the lid on. So at any point, they could get really escalated. And parents just unfortunately have to kind of navigate the temper tantrums. Don't let them just totally run the house with their temper tantrums, but they need to learn also that their temper tantrums won't get them what they want. Okay. Toddler theories. So they're in the anal stage. Think about They're learning potty training. So 1 to 3-year-old toddler age kids are in the anal phase of Freud's theory. Okay. They're learning control of their body secretions. Piaget, like I said, for the first year in toddlerhood, for age 2, they're in the sensory motor category of Piaget. And then from age 3 on, they're in the pre-conceptual phase. So they're starting to learn words as symbols. Okay, so you point to that. Okay, they know that what that is, but they don't understand the logic behind why that is. They're also very egocentric, so they're focused on themselves. Erickson's stage, they're in autonomy versus shame and doubt. So these kids want to please, they want to follow the rules. And if they're not doing that, then they feel shame and doubt. And they also want to do things themselves. Okay. Caloric needs decline by 100 calories per kg per day. So they're not needing as many calories as infants needed. Also, their milk intake should be limited to no more than 24 ounces a day. Otherwise, they're not going to be eating well. Okay. Serving size is 1 tablespoon per solid year of solid food per year of age. That's an acceptable like minimum serving size. So think about serving sizes. That can be a struggle for parents who are obese. They might be giving babies and toddlers huge serving sizes that are way out of line for that kiddo. Food should be chopped up into 5 pieces, obviously for risk of choking. And then you should be making sure you're offering a variety of different foods. Okay. So it is 11:27. Who would like for me to keep going? We have quite a few pages, or let's see how many. Yeah, we have quite a few pages left because then we go into the theorist piece. We have like 10 slides left. If you guys want me to keep going, I sure can. Otherwise, if you guys want to hop off, you can hop off now. So we didn't get to the Kahoot this week. I'm sorry.
The Kahoot already uploaded, like to our modules.
Yep, in your announcements. Yep, the Kahoot for each week will be in your announcements. So you guys can use that for studying for your quiz next week. So your quiz next week will be over infant and toddlers and the theorists.
Yeah, I'm gonna stay for the theorists because you said it's on there, so I want to know.
Yep, it's on there, and there's also a separate PowerPoint as well for the theorist. Okay. All right.
Will we have math on your exam and quizzes, like weight-based stuff? Like
on the exams, yes.
Okay.
Usually, well, all previous terms I have not seen math on quizzes. But on the exams, yes, it will be weight-based. And on the study guides, there will be questions usually. And we have a separate worksheet for math too, of like practice problems that you can do.
Okay, and as far as your NCLEX homework, I know, like, for example, our med-surg class, we cannot submit it unless we have a 90 or above. Is it going to be the same for peds or?
I don't necessarily have that, but I think it's silly to not get 100% when you can continue to redo it. You know, just because it adds, I mean, that only helps your grade. So if you're going to turn it in and you only have a 70, that's not going to help you out.
Okay. Yeah, I was just asking because even if we would submit ours with like an 88 in med-surg, she'd give us a 0 for it.
Yeah, no, we don't have that rule in peds.
Okay.
Any other questions before we just keep going here for this last little bit?
What did you say the quiz was over? The theorist?
So the quiz is going to be over week 1 material. So everything that we went over today will be on the quiz next week. Use your study guide, okay? I cannot tell you how many people at the end of the term said, oh my gosh, if I would have just looked at those study guides the first couple weeks, it would have helped me tremendously on the quizzes and the first exam. The first exam is hard because it's theorist and it's knowing all of your growth and development from infancy to adolescence. So it's a lot, okay? I'm not going to lie to you guys. It's a lot. So make sure you guys are using the materials that I've given to you and that you guys are reading. If you're doing those things and watching exam reviews, you should be successful in this course. Okay. All right. I'm going to go to this page here. I'm going to have to click all the way back through. Yep. Okay. The next piece is toddlers who are picky and how to manage them as parents. So pickiness in toddlerhood is totally normal, okay? They get really selective with their foods. They might not want to eat green foods. They might not want to eat orange foods. They might think it smells bad. They might say they don't like the texture, but they still have to eat these things, okay? So telling parents, like, not giving them alternatives is the best thing to do, because if you're providing them with a whole separate meal just for them to eat, it's going to be a lot harder as they get older to correct that, okay? So keep offering those foods. Talk about how that helps to maintain their growth and their development. They are toddlers, so they won't be impressed with that response, but just keep offering those things. Kids have feeding disorders or eating disorders. You know, that's going to be cause for concern. And then, you know, maybe some protein shakes or something like that need to be utilized. The other piece with picky eater kids is making sure that they're not drinking all their calories. So they're not having, you know, like 40 ounces of milk a day. That's not going to be helpful for them trying to eat. Okay, so main concepts review for theorists. So Freud is your psychosexual focused personality development, okay? Erikson is going to be your developmental through your development through challenges throughout your lifetime, okay? Piaget is cognitive development, so that's influenced by your age and your maturation and how mature you are. Maslow's hierarchy of needs, that looks at your category of needs and how that influences the kiddo's behaviors and how they kind of progress through their theories. I'm going to keep going. I do have videos for Freud and all of that, but I'm going to keep going. So 8 psychosocial stages are within the Erikson theoretical framework, but 5 are applicable to children. So Erikson's focuses on infancy to death for development stages, okay? It looks at different developmental crises and then healthy versus unhealthy outcomes. So we'll go through that too. So pediatric Erikson stages. Infancy is trust versus mistrust. And remember, infancy is a year and under, okay? Like I said, trust is that child cries, they get fed, they cry, they have their diaper changed, they cry, they have their needs met. Infants cry and cry and cry and cry and cry and don't have any of their needs met or aren't taken care of, then they're going to be in the mistrust category and they're going to stay in infancy and not progress to the next stage. Autonomy versus shame and doubt. This is toddlerhood. So this is 1 to 3 years of age, okay? Autonomy means they want to do things themselves. They want to people please, but also they want to do things themselves the way that they want to do. And if they're not allowed to do that, then they're going to have shame and doubt. So you need to let these kids, you know, pick their outfits, even if they're not matching, get themselves dressed, do things for you that they can do. Okay. So that way they don't get stuck in the shame and doubt area. Piaget, like I said, this is cognitive development. So they're looking at assimilating and accommodation and object permanence, which you guys should read about or have read about in the 9-month age group. So that is, you put a ball in front of that kiddo and you cover it up with a blanket, and they know that that object is still there just under the blanket. That is something that in the sensory motor stage they will figure out. Stranger anxiety is also in the sensory motor stage. Okay. And birth to 2 years of age is sensory motor, and 2 to 7 is pre-operational. So that's when they're egocentric, they're focused on themselves, and trying to figure out their own world based on that. Infants learn through senses, okay? Touch, smell, sight, taste, hearing. Repetitive, pleasurable behaviors, object permanence, stranger anxiety, curiosity, and exploration. Those are all things that are happening during the sensory motor period of development. Pre-operational, what you're seeing is that egocentrism, so they're focused on themselves, their magical thinking, they're giving animals human traits, so animism is what that's called, okay? So that's the kind of things that they're doing. Maslow's hierarchy, this is Maslow's hierarchy of needs. So if they do not have their physiological needs met, so air, water, food, they're able to go to the bathroom, they're able to rest, then it's not likely that they're going to progress through their Erikson stages or their Piaget stages and things like that appropriately, okay? So they have to have all of these foundations to be able to go to the next step in Maslow's hierarchy of needs, and to also go to the next step in the development. Okay, let me pull up those videos for you guys really quick. They're quick little YouTube videos. They are on, they should be in our announcement. If they're not, though, I will put them there. Let's see. Now this isn't going to load for me. Okay, well, it's not going to load for me right now to play those videos, but they are in your week 1 announcements, and if they're not there, they will be there. Okay. So those are just quick little breakdowns of the differences between Erikson's, Freud, and Piaget's, and what each kind of another way to break it down. Okay. Math tutoring wise, there are helpful math handouts and videos that will be posted before exam 1. And before, honestly, each of the exams within the exam review. There's handouts for each one. If you're struggling, you can let me know, but there's a video that Professor Bogart does that I'll post with the first exam review content that really breaks things down really easily. But like I said, if you need extra help, I'm more than willing to help you. Okay. All right, what else? I'm sorry, I don't know why our SharePoint thing isn't working right now, but it's not. So I'll make sure that those videos are on there as soon as I can. Okay. Study your study guide for next week's quiz. Make sure you've read all your material. Okay. Alrighty. If you guys don't have anything else, I will see you next week.
Thank you.
Thank you.
Yep, see you guys later.
All right, bye-bye.
Yep, bye.